and thank you for joining us again. This week we'll be discussing and showing you examples of how we can teach our learners to tolerate situations that they might find difficult. So our learners can struggle to tolerate various situations like medical procedures, daily routines and other experiences. Medical procedures that our learners can struggle with could be dentist visits, having a blood test or having their blood pressure taken and wearing a face covering. Daily routines that might be challenging for our learners might be having their teeth brushed or their nails cut, wearing certain clothing like a coat or taking medication. And other situations that our learners might struggle with could be getting a haircut, sharing their toys or people brushing past them. Our learners might also find situations that are time related difficult. So for example, they might struggle to tolerate waiting with us, or they might find it difficult to watch a sibling's choice of TV programme for a certain period of time. When we teach our learners how to tolerate these situations, we'll look at the experience as a whole. So similar to self-help, we look at the small steps that make up the whole situation, but the way that we teach is slightly different. So we'll still use reinforcement to increase the likelihood of the behaviours that we want to see again in the future, but now we're going to show you how you can teach these skills.
In order to teach our learners to tolerate situations that they might find difficult, we need to look at the experience as a whole, and then we need to work out what the small steps are involved that make up that situation. Let's go through an example together. So you might have a learner that finds it really difficult to go and have their blood pressure taken at the doctor's. Think about that experience and all the steps involved in having your blood pressure taken. So first you have to go and sit on the chair in the doctor's office. Then the doctor's going to get out all the medical equipment and you need to be able to sit there and tolerate the medical equipment being out. Then you need to tolerate the doctor handling the equipment. Then you might need to tolerate having your arm out whilst the doctor has hold of the blood pressure machine. Then you might need to tolerate having the sleeve placed onto your arm with the blood pressure machine off. And then you need to tolerate having the blood pressure sleeve on your arm and the machine being on. And then you need to tolerate this for an increasing amount of time in order to allow the machine to be able to take the reading. Once you've identified all the steps that make up that experience, we now need to decide on a starting point for our learner. Now, what you want to do is you want to pinpoint the point that they're going to start showing some reluctance. Now, maybe they move their arm away from the blood pressure machine, or they move away from the area, or they might start engaging in challenging behaviour. Now, once you've identified the step that they're finding aversive, then we can create a hierarchy of the steps that we need to work on in order for them to be able to tolerate the whole experience. Now remember, when you are deciding on a starting point, it's going to be different for every individual. So that's why it's really important that we look at that hierarchy and we see at what point our learners start showing some signs of distress. So if we take the blood pressure example, it could be that one child is able to go into the doctor's room, they're able to sit on the chair, they tolerate the doctor getting the medical equipment out, and they tolerate it being on their arm with the machine off, but as soon as the machine's turned on, then they rip it off and they move away. So we know that the step they need to start working on is tolerating having the blood pressure machine on whilst it's on their arm. However, I might have another individual that may tolerate walking into the doctor's surgery, sitting on the chair, but as soon as the medical equipment come out, they then start engaging in challenging behaviour. So for that individual, we want to start on them tolerating just the medical equipment being out. Now you've identified a starting point, and you have a hierarchy of the steps involved for your learner to tolerate that situation, you now want to identify a reinforcer to use to reinforce the tolerance. Now, ideally, this needs to be something that your learner really enjoys. So it could be their favourite toy, it could be an iPad, or their favourite snacks. Similar to self-help, we're going to be working on one step at a time. And we want to start off by working on that step that you've previously identified that they either had challenging behaviour on or they started showing signs of distress. Allow your learners to do all the steps up until the one that they're working on. Now, if they do the step that they're working on successfully, reinforce this straight away. So if you're using the iPad, then deliver the iPad straight away. If your learner has challenging behaviour or they start showing signs of distress, you can allow them just to leave the area. Once they've calmed down, bring them back and just try again. If you've done this a few times and they're still having challenging behaviour or they're still showing signs of distress, then what you can do is just get them to complete the step prior to the one that they're working on. So in the example of the blood pressure machine, if your learner's working on having the sleeve on their arm and the machine on, and they've been having challenging behaviour, then maybe bring them back and just get them to tolerate having the sleeve on with the machine off. And we then want to reinforce there. Now remember, if you have had to use a step prior to the one that they're working on, maybe just deliver the reinforcer for a short amount of time. So if it is the iPad, they can get it for a minute rather than say 5 minutes. Now, what we want to do is we want to make sure that our learner is really competent at doing that step successfully with no challenging behaviour before we then start working on the next step. So once they've tolerated the sleeve on and the machine off a few times, then we can start working on having the sleeve on and the machine on. For some of our learners, we may also need to work on teaching them to tolerate these situations for increasing amounts of time. So again, in the example of the blood pressure machine, they may be able to tolerate the sleeve on their arm and the machine being on for 5 seconds, but this isn't long enough for the machine to get the reading. So we might need to break down the time into small steps again. So maybe to begin with, they need to tolerate it for 10 seconds. And then maybe 30 seconds, a minute, 2 minutes, and so on and so forth, depending on the situation.
So for this example, I'm going to teach my learner how to tolerate having his hair cut with clippers. We've broken down this process into a hierarchy of steps to teach my learner that it's not so scary to have his hair cut. These are the steps we've identified. So firstly, he's going to learn to tolerate the clippers being on and in close proximity to his head, so we can get closer and closer the more tolerant he is. Next, we're going to practice the whole steps involved in having your hair cut, but we're going to leave the guard on the clippers for now. So firstly, we're going to have the clippers on and gently touch his head. Next, we're going to have the clippers on and shave for 1 stroke at the back of his head. Then we're going to have the clippers on and shave for 2 strokes, doing the back and top of his head. Next, we're going to have the clippers on and then shave for 4 strokes, so the back, top and sides of his head. Then we're going to increase the amount of strokes until he can tolerate the whole of his head being covered, again with the guard on. At this point, we'll know how tolerant he is. He's worked through all of these steps and he knows it's not so scary, so that we can successfully have the clippers on with no guard and shave the whole head of hair. Obviously, these steps are going to look very different for different learners. Some may need more steps involved to be able to tolerate the process, and some may need less. For example, one learner might not be able to tolerate wearing a gown, so we may have to start there. Another may not be able to tolerate having the hair brushed off at the end, so we may need to add that in. Others may need some of the steps taken out, so they may, once they've learned how to have 1 shave stroked at the back of the head, they can then tolerate the whole process. So it is going to be very individualised for your learner. But let's just have a look at what this is like for my learner now. So the first step is I'm going to have the clippers on, but quite far away from his head. If you can tolerate this, then I'll deliver reinforcement straight away. And great, here you go. So that was successful. You may not necessarily work through all these steps in one session, but just for the purpose of this demonstration, I'm going to show you. Sit, can I have a go? Thank you. So I'm going to get a little bit closer. Yeah, excellent. Here we go. You can give them a bit longer to play with their phone or whatever the reinforcement is in real life. Okay, ready? Mind with that? Thank you. So in that example, he moved away. Your learner may engage in more challenging behaviour. They may run away from the area entirely. That's okay. We don't want to physically make them come back in that moment because we don't want to make it become too aversive. But I'm not going to deliver reinforcement in this instance. When he's calm, I'll bring him back and I'll try that again. As soon as he tolerates it, then I will deliver the reinforcement. Excellent, well done. Here you go. So he was successful in that trial. Then we can move on to the next step of touching the back of his head with the clippers. That's it, ready? Thank you. Really well done, here we go. The process will just carry on like that as I explain through all of the steps. Just remember, if your learner engaged in challenging behaviour or is too anxious and wants to escape, that's okay, as long as they don't get the reinforcement that they would get if they were to tolerate it. Just bring them back when they're calm and try again.
In this video, we're going to show you how to teach your learner to tolerate wearing a face mask. First, we're going to put it over their ears, then their ears and their chin, then their ears, chin and mouth, and finally their ears, chin, mouth and nose. First we're going to put the face mask over the ears and let our learner tolerate the face mask around their ears. Once they're tolerating that, we'll reinforce. Once the learner has tolerated the face mask over their ears, I'm just going to move it up over the chin and then reinforce. Once the learner's tolerating the face mask over their ears and over their chin, I'm just going to bring it up and reinforce. Well done. There you go. And finally, once the learner is tolerating wearing the face mask over their ears, over their chin, over their mouth, I'm going to bring it up over their nose and reinforce. Obviously, I've done this very, very quickly, and for all our learners, it may take much longer than what I've shown you here. You may also want to teach your learner to tolerate you wearing a mask.
So for this week's session, we have looked at teaching tolerating skills. We have discussed various examples of situations our learners may find difficult. Being able to tolerate medical procedures, such as having a blood test, or tolerating sitting in a dentist chair, having our teeth checked, or basic hygiene routines, such as allowing someone to clean our learners' teeth, or allowing someone to cut their hair, are extremely important for our learners to be able to live a healthy life. For example, our learners will require regular health checks, or if our learners become ill, this will require our learners to visit and be examined by a doctor. This will entail the skills to tolerate entering the doctor's surgery, sitting in the waiting area, sitting in the doctor's office, allowing the doctor to do essential checks such as blood pressure, our learner's height and weight, and many more checks depending on what the doctor may need to examine. In this scenario, some of our learners may want to leave the situation and may engage in challenging behaviours to escape the situations they find difficult. It is important that we teach our learners to tolerate all the steps required to visit the doctor's surgery and all the items within the surgery. When teaching our learners to tolerate places, settings and procedures, remember to use highly preferred reinforcers to establish these appropriate behaviours for tolerating within these situations. Teaching tolerating skills to our learners in small steps, gradually completing the whole skill, or teaching our learners to wait for short amounts of time, then gradually increasing the time our learners are required to wait, will expand our learners' experiences to many different situations and environments within the community. Thanks for watching. See you next time.